I'm Glenn McGinnis, and this is Outburst. This week, should the simple possession of illegal street drugs be decriminalized?
Don't legalize it, just decriminalize it.
Just because it makes it easier for people to get help?
No.
It could be beneficial.
But first, the span of influence COVID-19 has had on our lives also includes our personal finances. Not only how we earn it, but also the frequency in which we spend it. With lockdowns occurring across the country during the span of this pandemic, many of us have changed how we buy, what we buy, or even where we buy. So we took to the streets to ask you about your spending habits lately. Our question:
how has the pandemic changed how you spend your money?
Actually, it didn't change much for me because, to be honest, actually I saved money during the pandemic because I didn't lose my job. There's not enough going out, stayed home. So I think it helped me save more money. And I've been looking into investing more ever since the pandemic. You're sitting at home doing nothing. And it's more spending my money more into savings and like putting my money into stocks. I think that helped.
I feel like just because you're not going out as much, you're definitely just not spending as much money because you're at home most of the time. So I don't know, it's unfortunate. Yeah, you have like online services, but even then it gives you limited like options to like support local, I guess. So a lot of the time you're kind of like trying your best to stay local, but still staying online because of the pandemic. So you don't want to go out because you're supposed to stay home. So I think it's made you kind of like more directed towards like larger companies, which is unfortunate because you want to support the little companies that are still running and trying to get them to stay open. But yeah, I think it kind of just forces you in a way to like just support the bigger companies and they just get bigger, which is unfortunate. I would love to support smaller ones, but yeah, I think just trying to make it easier with the pandemic to just stay home. Yeah, unfortunately.
So the pandemic's changed the way I spend money and just spending it a lot more locally, focused on, the city I live in and obviously not traveling as much, so spending it here.
Basically, I've been spending less and saving more. I don't go to restaurants anymore. I shop online. It's not good for the local economy, but it satisfies that urge in me that says spend, buy new things.
How the pandemic's changed the way I spend money in almost every way. Almost every purchase is digital, hardly ever touch cash. Order stuff online, including during the worst of it, delivery at home. So that's quite a lot.
Definitely a lot more like subscriptions to streaming programs. Less money, obviously, on entertainment, like outside of my home. A lot more online purchases of stuff I don't need, that's for sure.
I'm afraid my answers are all a little boring. It hasn't really, that I can think of, had any impact. I haven't had to buy medication so far.
Less eating out, but now we have been eating out.
Yeah.
Like since it has opened.
Yeah, I don't know. I would say my spending habits haven't really like changed that much. I wasn't really too frivolous of a buyer anyways, so just the basics.
Honestly, as like a university student, I don't spend much money anyway, so I mean, I think it's been good for my savings because I'm not going out at all, so I guess saving more. So
I think we made economies.
Yeah, we are not going to restaurants anymore.
No traveling.
No traveling, yeah.
So
that was a big change.
Yeah, so I guess we saved money.
I've been buying a lot of stuff online as opposed to in-store. Kind of makes me, I feel like I'm spending more money than before just because I have to like buy a bunch of stuff online that I have to try. Guess I have to return it, but returns are hard to do, so
yeah.
I'm like the poorest I've ever been.
Also, usually they only do a minimum like free shipping, so you have to spend at least like $50. So obviously you think it's a good deal, so you put in the extra cash. So it does eat at your bank account a lot more.
Well, I've actually been buying less because the pressure to present yourself in public has diminished, so I don't feel the need to consume as much as I did before.
I've definitely started saving a lot more. I'm trying to be more financially responsible just because my work got taken away really quickly. Overnight, I lost a lot of my piano students. I'm a freelance piano teacher. And on top of that, my work shut down. So I've just definitely tried to save more money where I can.
Haven't been spending much because it's mostly at home. I'm back to work now, but certainly been able to save up for some trips and stuff to do around the house, so it's been pretty narrow.
Well, I can speak on behalf of my parents who are in their 70s. They are now online shoppers for the first time ever. Having things delivered directly into their home, that's all new for them.
Yes, and kind of liking it, but I'm glad to be able to get back out too once this settles down, because it's no fun as it is with masks.
Yeah. Community, being in touch with one another and being each other's company, like in person, is dearly missed. Dearly missed.
Spend a lot more on renovations than we usually do. We usually spend a lot on travel because we're retired. We travel
online shopping a
lot.
lot.
A lot of online shopping.
How has it changed? Okay.
Yeah, that's about it. Yeah.
Several months back, Vancouver's Mayor Kennedy Stewart said his city was in the midst of an opioid crisis, and he asked the federal government to do something it's never done before: decriminalize illegal street drugs within Vancouver city limits. He says this would take the criminal element out and perhaps save lives. Stewart's proposal was passed unanimously by Vancouver City Council, and this practice has worked in places like Portugal for some time now. But would it work here? Our question:
should simple possession of illegal street drugs be decriminalized?
That's a tough question. I know in Portugal it works well for them. They've been doing it since 2001, they've had good results. So I think if we follow that trend, then yeah, I think it could be beneficial.
Well, narcotics, no. I think that should be regulated or left as it is.
Yeah, I think so. I don't think it helps to maintaining that as a criminal act. I mean, it doesn't help. I think those people need help. They don't need to be, penalized further than their situation already is penalizing them, I think.
Addiction it's a mental illness. And people struggle with it. And if someone's suffering from addiction, what they need is help, not punishment. And especially like now, it's like so hard for people to find joy in a lot of stuff. And so for some people, that's like they need it to feel happy. And criminalizing that's not going to solve any problems. What that does is it makes people it's a shadier thing, so they can't get access to like clean needles, and then that's like an issue with spreading diseases. And so everything would be just so much safer if it was decriminalized.
Oh, that is a tough question. I would say yes, if it's a very small amount. Like, very small amount. If there's any question, if it's for the purposes of trafficking, then I would say no.
No. How come? No real reason. Just I don't think you should have a whole ton of it.
No, I don't think so. I still think there's hard drugs that you just don't want to put into people's hands.
Yes. I'm very pro decriminalizing all drugs just because it makes it easier for people to get help when they do struggle with addiction. It's been proven to work in Portugal. They've decriminalized all of their drugs, except for like very large quantities of drugs, and it's considered trafficking. But just simple possession, no, I don't think it should be criminalized.
I guess it depends on the drug. I'd say by and large, yes. I mean, I would think, marijuana most certainly. I'm in favor of that. I guess it really depends on the narcotic. Yeah.
Well, I would have been under the impression that it had been with the legalization of marijuana to a certain amount of weight per person. It is decriminalized, I had thought. So I guess I would say it should be decriminalized.
Me as well, even at the age I'm at.
Yeah, because why you chuck them in jail and that costs a fortune, and what do you do with them then, right? You're helping them out. They'll be in there for a week or two. Other than we're feeding them, then at least they get straight food. And But I don't know. I think we should treat them rather than. It's too expensive to send people for jail for if they're non-violent. You know, why waste time and money in those people as well? Like,
if it becomes safe, then I think it's a good idea.
So I would say yeah. Like if people, like we can't stop people from using them. They're going to do it no matter what. So if there's someone else looking at it, making sure that it's safe and that everyone is okay, if that's what they choose to do with their life, that's what they choose to do. You can't stop someone from doing that, so make sure they're safe if they're going to do it, I guess. So I would say yeah.
I think it should be, because I feel like we need to help people who are on these drugs, help them out. They need counseling, obviously. So I think putting them behind the bars is not the answer, because it never solved anything. I believe some countries have in Europe where it's all the drugs are legalized, and then people use it, like they have centers where they use it. So I think we should step into that, but yeah, I think that's where we should be heading.
It's a really complicated problem. I don't know, to be quite honest with you. I just know that there's a lot of overdoses. There's not enough resources set aside for counseling, rehabilitation, that type of thing. So I don't know if that's part of the equation on how to move forward.
Absolutely. Don't legalize it, just decriminalize it.
Any reasons behind that?
Well, because the legal profession is just swamped with idiocy. They make it legal, now we're going to charge you. It doesn't make any sense. Simply decriminalize it. Take it as it is. If you've got way too much for your personal possession, you should get something. But personal possession, oh my God, just decriminalize it.
Yes, I think it should be decriminalized because failing to do so kills a lot of people. And particularly if you're a physician, do no harm. I think that's true for all of the rest of us too. Lots of people die because they don't have access to clean street drugs. They don't know what they're getting, and it kills them.
Who was Canada's first Francophone Prime Minister? Sir Wilfrid Laurier, Louis Saint Laurent, Pierre Trudeau. So Laurier, Saint Laurent, or Trudeau?
Oh my, Trudeau.
Laurier, Saint Laurent, or Trudeau?
Saint Laurent. Laurier.
What was the other one? That was
Laurier, Saint Laurent, or Trudeau?
Saint Laurent.
Laurier.
I'm with him. Yes.
Oh dear. Louis Saint Laurent.
I think it's Louis Saint Laurent.
Let's go with that. Laurier.
It is Laurier.
Yeah. Thank
Very,
you.
very good.
The Right Honourable Sir Wilfrid Laurier holds the distinction of being a Canadian Member of Parliament for the longest period of time, 44 years and 11 months, from January 22nd, 1874, until his death on February 17th, 1919. Also, his record as the longest-serving leader of a Canadian political party, 31 years and 8 months, still stands to this day. But he's not done there. Laurier also became Canada's first Francophone Prime Minister, and his 15-year tenure remains the longest unbroken term among those who have held the office.
We've had some time now to reflect on and learn from COVID-19. For many of us, this pandemic has changed everything we'd ever known, and we have no certain sign of when things will go back to normal, if ever. So we sent our cameras out to ask Canadians to tell us their stories about how COVID-19 has affected them. Our question:
what impact has the pandemic had on you?
Well, it got me a job. I do sanitizing at 3 different office buildings, so yeah, that worked out good for me.
Ooh, yeah, well, where do I begin? Starting from changing my job, that was the first biggest one. Not being able to work full time. First of all, Government of Canada has been great helping me out, and then finding another job, which was also a tough gig because I've applied for literally more than 100 jobs and I got a response from like 5 of them. So it's been really tough, and finally I decided to go on my own and start my own business. So that's what I did.
I mean, there's always ups and downs in life. So, I mean, this is just a different factor, different phase of my life. I don't think there's anything overly negative or overly positive. It just is.
That's a really deep question. I've definitely had a lot more time to just think about what I'm doing with my life. I've recently graduated from school, so that on top of everything as well. I'm mostly just trying to figure out where I'm going to be in the next 10 years. It really puts things into perspective how easily things can change.
Oh, loss of income, off work for quite a period of time because I'm in retail services. So, spending more time at home. It's been a plus in terms of being with the dog and the family and whatnot. And, that's been certainly a big plus. But there's been a lot of minuses too. Glad to get back to a normal routine.
So the pandemic has had zero real impact upon me, only because my bubble of first family is all here close by. So we were always able to maintain that in-person contact with our initial 5. And other than, working out online instead of in a gym situation or necessarily on the trails or anything of that nature, that's a little different for me, but that would be it. And not a negative impact necessarily. I found them very positive as well.
We haven't seen our daughter, face to face. We live in Europe for over a year now, and she usually comes down, or we go down to visit her. So that's been pretty tough. Not being able to cross over to Ontario because Joanne's family's over and lives in Welland, Ontario. We haven't been able to go see them. We haven't seen them in over a year now.
Yeah.
So things like that's kind of affected us. Yeah.
See, I haven't seen my friends in months. This is the first time we see each other.
Oh, yeah.
So I've become closer with my family.
For me, I think mental health wise, there were a couple gray moments, but I think online presence and realizing the potential of communications is absolutely a positive side from the pandemic, and also being less afraid about calls. So yeah, I think that's how it's been for me.
Well, for same as Océane and Pierre-Luc, but for me, since I'm going to study abroad, figuring that out in this pandemic has been really uncertain, and whether I can go or can't go. So I've been very stressed, so that's kind of how the pandemic has affected me.
Well, it's definitely been difficult to keep a distance from all my friends and stuff, and having to, getting a job is really difficult, and so living off the little money that I have, it's definitely just been exhausting, I guess.
Well, I worked in a hostel, so the second the pandemic hit, I lost my job.
Not really too much. I live alone, so I don't have roommates that are going to bring the virus into the household. So I'm feeling fairly normal about it. I'm aware of it, of course.
Well, I'm retired also. One of the worst things for me was not being able to go anywhere. I was used to going to restaurants with my friends, so socializing, going to the museums, socializing. Probably that's the biggest impact.
Personally, it hasn't on me because I'm retired. But I certainly feel for the workers, all kinds of workers that have had to work in that environment, especially the healthcare system.
Honestly, I'm in university, so as a university student, it's been pretty brutal, I'd say. Every day kind of just feels like the same, being cooped up in your room. So, and I just feel every day I go on the news and I'm seeing something bad happening in the world. So it's been pretty discouraging, I'd say.
Oh my God.
It changed our lives, definitely. But not that much at the same time. No?
Well, less than for many people, right? We didn't lose our job. We're still healthy. So, we can't really complain. But obviously it had an impact on everybody. Social life is down the drain. But yeah, right. We don't want to complain because, compared to some people, it's nothing.
To be honest, not much. Because I barely go out anyways. So I stay at home most of the time. But it did, obviously I I used to go to shop like in the store. Now I shop everything online. I don't go to stores anymore. And also with pandemic, it showed you what it's like staying home with nothing open.
Probably for the last 25 years, I've been a workaholic, and it took something like this to stop me, to make me stay at home and make me take stock of my life and what was important. So a lot of the benefits to me have been really positive.
I don't do as much visiting other people, and nobody's come over. I actually don't live in Victoria. I live on one of the Gulf Islands. I live on Salt Spring. And it's cut tourist traffic down a great deal. Has its pluses for the ferry lines, but nobody's going anywhere. So it doesn't really matter. But I think it's made social life face-to-face much more difficult and much less intimate.
It has taught me to be, and I hope more people, that we have to now take responsibility for ourselves. Only then can we help anything. Take responsibility for yourself. No, nobody's going to bail you out. You don't want to wear your mask, don't wear your mask. You want to, I'm going to wear my mask. I'm going to do everything there is to save me from this.
There have been some encouraging COVID numbers as of late, especially in harder hit provinces like Ontario and Quebec. But even though these numbers are going down, it doesn't mean we're out of the woods just yet. But new variants continue to be a concern, and many Canadians are taking the steps necessary to help mitigate this virus and keep it that way. So, are you part of the solution? Our question.
What have you been doing to help flatten the curve?
I mean, I try to go grocery shopping every other week or so. I don't really see my friends. We have to be extra careful. I do live with roommates. So, yeah, I haven't really seen my friends in a while, but that's about it.
Masks everywhere, social distancing, not going to patios initially. Certainly not going anywhere where a lot of people are congregating. I mean, even when I'm out in public, I'm wearing my mask. Even with my 2 shots, and I'm 2 weeks into my second shot, so I'm probably pretty good. But until this thing is pretty eradicated, I'm pretty careful.
Well, we certainly have stepped forward whenever we were offered the opportunity to have vaccines. We were, online immediately getting our appointments, and currently are in the process of moving up our second appointments that we were originally prescribed. Certainly mask wearing has become the new accessory as ladies, so we have a number of those. And really maintaining our bubbles, like our initial bubbles when everything first occurred, staying with those until we feel a sense of full confidence that everyone is in a good place to be amongst each other again, and missing it, so wanting it badly.
Well, wearing our mask and washing our hands everywhere we go, not going out, staying home.
Staying at home, just seeing my family, like I said, not really hanging out with friends. Getting vaccinated. As soon as I could, I went out and I got my vaccines. And I'm actually getting my second dose tomorrow, but that's it.
Perfect. For me, it's just like getting only one person in the household to go to stores, try to keep contacts as low as possible, and always wearing a mask or doing your best. And also vaccinating, like that is objective number one, right? As a society, we should all collectively do our best, right, to flatten the curve.
Well, I try my best to just stay with like local businesses, helping them as much as I can. Getting essential jobs. Like if I was laid off, I just, instead of taking the government pay, trying to find a job that'll pay you. And as a young adult, like our immune systems are a bit better, and if I can just kind of stick it out and hope for the best and just stay a bit cleaner, then hey, I'll go find a job. So to flatten the curve, I guess, just finding work that I can help the community, just like how we all should if we're, yeah.
I've been flattening the curve by keeping my bubbles small, not traveling, and maintaining social distance, using a mask when, in close proximity to others. So it's been pretty straightforward, simple things. Working on my manners. I think that's what COVID was all about, was teaching people their manners. Give space, cover your mouth when you cough.
Well, I've been wearing my mask and obviously social distance. And also I think lockdowns didn't work. It's the vaccine. That's the one that helped bring the cases down.
Well, I bleached all of my groceries for at least 6 weeks. Went to grocery stores less often, stocked up on food that I still have, just in case I need it again, and probably would never buy normally. Stuff like that.
What have I done to flatten the curve? Well, I wear a mask everywhere. I got inoculated. Try to use the seniors' hours, because I am of an age, for shopping, all that kind of stuff. I try to encourage other people online where I can, or personally if I can, to get vaccinated, because that's the best thing all of us can do.
I have followed every single solitary rule all along. I've been happy to be at home and put my energy back in where it belongs, your family and your home.
Just following the rules, right?
Yeah, mask all the time. Distance.
No party.
No party. Yeah.
And therefore, the
social
the social life down the drain. But that's the price to pay, right?
I mean, I respected the measures put in place, and I use my own good judgment to do it as well.
Well, I wear my mask all the time. Whenever I'm in now, I used to wear it even outside 24/7 all the time whenever I went out, but now it's just when I'm indoors. Wash my hands. I avoided going on buses and metros a lot, so yeah, I pretty well stayed away from crowds completely.
I wash my hands. I'm very cautious where I go. When I do shopping, I try to do it as early as possible.
I got a vaccine, got vaccinated.
I got my 2 vaccines now.
I'm only at 1. I don't know, just being safe, not really seeing people that much and staying at home and doing my work and
Hanging out outside more than inside.
yeah, I haven't really had friends over and I don't know, doing our part.
Actually, me and my boyfriend are very diligent, so we both have our vaccines. We honestly stayed to ourselves the whole time. I'm not from here, so me and him just kind of cooped up in our apartment for most of the time, so I wasn't really even seeing family, so.
Thanks for watching this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. It's your turn to speak up, and we're listening.